So, fungal nail. It's a very common condition and one that I tend to find quite sad. Sad in the fact that it causes so many people embarrassment and stress, especially in the summer months. Well, to be fair, there's quite a few causes. People with low immune systems, such as diabetics, are often likely to be at risk. The secretion of increased glucose levels in the skin is almost a certain factor. We all like a pamper now and again, having manicures and pedicures, but the equipment might not have been properly sterilised at the cut price nail bars. This can be a source of infection. As can sharing your nail varnish with friends, they won't thank you for it, so stick to your own. Very hot places or lots of sporting activities can also increase the risk. Damaged, split, cracked or lifting nails from sports trauma or poorly fitting footwear can cause easy access into the nail for fungal infection. Athlete's foot infection can also play a part in spreading fungal spores to the nails. Well, any of these symptoms suggest there's every chance you may have it. Thickened nails. They can also be very painful and very claw-like looking. The colour of the nail may change to a chalky white, yellow or brown colour. You may start getting itching and they may also start to smell. The nails may start to crumble, loosen and white patches may start appearing on the nail bed. The infection can spread to other nails as it's very contagious. Athlete's foot infection is common in those with fungal nails as it's often the same fungus. So how can it be treated and how do I know for definite I've got it? So can I proceed with treatment? Gone are the days when you sent in your toenail clippings to your GP, wait and wait for up to 4 weeks to get the results. You can now take a quick, easy 5-minute fungal nail test. Yes, that's correct. Here at We Fix Feet, it can take just 5 minutes to find out. Only a tiny amount of nail is needed, in fact 1 gram of infected nail, and the test detects the presence of all fungal types. A small sample of nail is popped into a test tube, a solution is added, stirred and with a special test strip, if it changes colour, we've got a positive result and we're on our way to effective treatment and a confirmed fungal nail infection. Apply micota powder to your socks daily and into your shoes once a week, and the cream nightly will treat the fungus on your skin and living in your shoes and socks. We also recommend applying microcept to the nails on a daily basis. Regular visits to a foot care clinic to have the nails thinned down and remove any dead fungal nail every 6 to 8 weeks. If you have a special event and you want to hide those nails, then consider Toeflex Toenail Reconstruction. Toeflex creates a temporary nail over the damaged nail being treated that looks natural and can be painted. So don't be embarrassed of your toenails, talk to us today. For more information, visit our website or follow us on social media.